it is one of the common ENT issues what we dealing each and every day. This will not come like in 1 or 2 days. It's a long time problem, like a complication. Every 1 or 2 months the child will have infections. The patient can't breathe properly, so the sleep will be disturbed. It will affect the quality of life, behavior of the child, school performance, all the things.
Hello dear friends, good evening. Welcome to yet another episode of BMC Global Live Al-Hilal Health World, Nothing But Lifestyle. In each episode of this talk show, we try to bring before you an expert doctor from Al-Hilal Hospital to address your various health issues. Today we will be discussing about the causes, symptoms and treatment options of tonsillitis and adenoid issues. And the doctor joining us today is Dr. Shaheer Ibrahim from Al-Hilal Premier Hospital. He is a specialist ENT surgeon with an experience of more than 10 years. So doctor, welcome to the show.
Okay, thank you very much. Yes.
Thank you for joining us today.
Okay, thank you.
So doctor, can you explain about the tonsils and adenoids in detail for us, and also the role they play in our body?
Okay. If we are talking about tonsils and adenoids, it is one of the common ENT issues what we dealing each and every day. Okay, these tonsils and adenoids, they are like our safeguards. Like they are situated, tonsils are situated just behind our throat, and adenoids are behind the nose. So it's just a lymphoid tissue. Okay, lymphoid tissue, it helps for our immunity. So it's like a guard. Okay, so it will like in our inhalation or in swallowing, there will be more many allergens, bacteria and viruses. So they will filter these organisms. Okay, and they will prime our body to make an immune response. So basically it's a like a it's in a Walder's ring. It is like a ring, like a lymphoid tissue in the throat. So these are the main subjects in this Walder's ring, and it helps our body to build immunity. That is the main role of adenoids and tonsils.
Then why do they become problematic, especially in children?
Yes. As I said, these adenoids and tonsils, they are like our immune systems. Sometimes because of chronic irritations like inflammations, like recurrent infections or inflammation, what happens, it will get swollen up, like enlarged. So if it becomes problematic or enlarged, like very big, what happens, some especially children, they will feel symptoms like nasal blockage or sore throat.
Okay. Doctor, what are the common causes of tonsillitis, and are some people more prone to tonsillitis than others?
The common problems, like it is mainly because of virus or bacteria. It's viral infection or bacterial infection. Okay, so what happens in some cases, like recurrent infections, like if the patient is having a recurrent episode of tonsillitis, what happens, it will get swollen up. And same like for adenoid, if it is swollen up very big, what happens, there is a tubal connection, that ventilation tube is there, it connects to the ear, so it will get blocked because of the enlarged adenoids. So it will cause fluid collection inside the ear, and it will cause recurrent ear infections. And other thing is the nasal airway get narrowed because of the adenoid enlargement. So the patients will feel mouth breathing because of nasal blockage, sleep apnea, nasal blockage. These are the symptoms usually we are seeing for adenoid and tonsillitis.
Can lifestyle factors like diet and hygiene influence tonsil and adenoid health?
Yes, okay. Yeah, that is very important. Yes, I told you, that tonsillitis, it is because of recurrent infections. So these dietary changes and lifestyle plays a very important role. One of the reasons for these recurrent infections is especially less hygiene. Okay, so we have to have very good hygiene, especially recurrent hand wash and overcrowding. Like I have seen many cases like adenoid and tonsillitis is mainly in daycare children. Like if you are going for like daycare, like there will be so much overcrowding and definitely more contact. like if one child is having some flu or like cold, the other child will get very very easily. So the thing is, it will be like a cycle. The child is having recurrent cold and infections. So what happens, this recurrent infections or allergies, and another reason is like passive smoking. If the child is exposed to passive smoking or environmental pollutions like dusty areas or climate, the pollutions and all, it will all affect the body changes. So we have to have very good personal hygiene as well as very good air, like polluted air, it will make more prone for these allergies, and it will cause recurrent infections, inflammation in the adenoid, and later on it will become enlarged. So keep a good hygiene and very good balanced diet, because if you have a very balanced diet having all the proteins, vitamins, everything, it will naturally improve our immune system, and it will support like one of the other reason for adenoiditis is not only infection, improper immune reactions. Like all the time, if the infection is not treated well, what happens, our immunity, it will make more like immune responses, so it will inflame again, it will inflame. So whenever the kid is having infections, we have to give proper management. If the child is having bacterial infection, like if the symptoms are not improved within 72 hours, we have to give like if the bacterial infection, we have to give antibiotic. So these things it matters. If it persists for long time, this will happen, like adenoid inflammation and hypertrophy.
Now, can you explain about the symptoms of this condition other than the sore throat?
Yeah, I will come to it very detail. So basically it starts with the sore throat for tonsillitis. So what happens in recurrent infection, the child will have like every 1 or 2 months the child will have infections. Like if it is the patient is having recurrent tonsillitis, like 7 or more episode of tonsillitis per year, that means he is having chronic infection and maybe he needs surgery. So that is one of the main symptoms, is sore throat. Other symptoms, it's because of the functional block, like enlarged tonsils and enlarged adenoids, that will block our nasal airway. So what happens, if it blocks the nasal airway, the patient can't breathe properly, so the sleep will be disturbed. Okay, so child start to snore. Okay, so all snoring it's not normal. Like if the child snores like a little grandpa, it's not a cute thing. Like we have to get a ENT opinion very fast. Like one of the main complaints the patient telling in the OP is snoring, mouth breathing, and this prolonged mouth breathing. What happens, the throat will become dry, one of the things, and this is the early developmental age. So there will be change in the facial structures, there will be high arched palate, crowding of teeth, dental abnormalities, speech delay, and hearing issues. Hearing issues especially coming from, as I told, the ventilation tube blockage. Because of enlarged adenoids, there is a eustachian tube. It is opening into the nasopharynx. So what happens, if the adenoid is enlarged, it will block the eustachian tube. So the fluid will collect inside the middle ear. So fluid will collect and the child will feel hearing loss. So definitely the school performance will be low. So lot of factors, like not only it's related to the ear, nose, throat, it will have low school performance, behavioral abnormality, because child is not sleeping well because of the snoring, mouth breathing. There will be sometimes sleep apnea because the child is not getting proper oxygen. So like long term effect, there will be pulmonary hypertension and cardiac stress. So these are all the things are linked. So this will not come like in 1 or 2 days. It's a long time problem, like a complication. So we have to check if the child is having like presence of these symptoms. We have to check. as early as possible.
So all this affect the quality of life of the
Quality
child.
of characters. It will affect the quality of life, behavior of the child, school performance, all the things.
Then how is this condition treated, and when do you start antibiotics?
Yes. So every case is individually we have to treat, because it is different from one person to another. Some kids will come with long history, like 2 to 3 years of snoring, mouth breathing, and having all the adenoid facies, as I told, crowding of teeth, eye arched palate. So we need a team of doctors. We need ENT surgeon to correct the teeth by a dental surgeon. So if the child is suffering from these symptoms, we have to treat as early as possible. So if it is an acute throat pain, we will take as a simple thing first, sore throat. Okay, if the sore throat, the patient is having sore throat and fever, initially we will treat symptomatically. Better to check with an physician or ENT help and check is there any congestion or pustule in the tonsils, okay, and give symptomatic relief like painkillers like acetaminophen, paracetamol, ibuprofen, something like that, and give proper hydration. Hydration is very important because patient is having sore throat, so the body fluid will be less because he is not difficulty to swallow, so we have to increase the hydration and give some painkillers. And if the symptom is not improving within 72 hours, that means it's increasing, we have to consider a bacterial infection. We have to take a throat swab for diagnosing bacterial infection, and improperly we have to treat with the antibiotic. If it is bacteria, we have to treat with the antibiotic. Majority of the cases are viral infection, what we are seeing in the OPD, but if the patient is not improving within 72 hours, we have to check whether it is bacteria and start with an antibiotic.
Now, can you suggest some home remedies to manage the symptoms?
Home remedies, as I told, we can use warm saline gargle. It is very important. If the child is having sore throat, it is very effective and it is very good thing. Take a warm saline, like in some water, put some saline, warm water, put saline and do a gargle 2 times daily, along with some painkillers like paracetamol is enough. And if the patient is having some flu, we can add one antihistamine and keep hydrated.
Doctor, at what point the doctor will decide to remove the tonsil or adenoid using surgery?
It depends upon the symptoms, the severity of symptoms and duration. Will take about tonsils. Like as I told, the main symptoms will be sore throat. Okay, so the sore throat, if the child is having more than 7 episodes per year, it is one indication. Like the child is having recurrent infections each and every month. He is getting 1 or 2 months. He is getting recurrent infections. Along with, there will be one other signs will be inflamed and tender lymph nodes. Okay, if the child is having tender lymph nodes and enlarged tonsils, there are grades like grade 1 to 4. If the child is having 3 or 4 grade along with the recurrent infection, that is one of the indication. And coming to the adenoids, it usually causes nasal blockage. So because of the nasal block, what happens, the child will have mouth breathing. So the persistent mouth breathing along with sleep apnea. Sleep apnea means patient will stop breathe in between. Okay, so that definitely the person who is sleeping with the child, they will recognize they will suddenly stop breathe for some time. That is one indication, because he can't take breathe properly because of the enlarged adenoids. This is one of the indication, like chronic obstructive sleep apnea. This is known as chronic obstructive sleep apnea. And other one indication is, like as I told, the adenoids will block the eustachian tube, and because of the blockage, there will be fluid collection inside the middle ear. Because of this fluid collection, the child will feel loss of hearing, like ear blockage. All the time, this is especially coming from classroom. Teacher will tell the child is not performing well in the school, because he can't listen
Can't hear
properly.
proper.
All the time now in home itself, he will keep the TV volume very high because he can't hear properly. So if we call the child, he is not listening. So we have to pick up very early these things, because this is all temporary hearing loss. We can treat it very well along with the adenoid removal. If you put a tube inside the middle ear, this fluid will come out and we can fix it very easily. So these are the indications for surgery. As I told, chronic obstructive sleep apnea, recurrent throat infections, and one of the reason is serous otitis media, as I told, fluid collection inside the middle ear. And other indications like behavioral changes, like child is not sleeping properly, and as I told, the quality of life is not good, like he is not properly improving his study. And one of the other reason is adenoid facies. Because of chronic mouth breathing, his jaw and the bones, like jaw bones, are altered, like high arched palate, crowding of teeth, very long face. These are the indications. So we have to like, it is individually tailored. It is not like this case we have to go for. We have to sit with the patient and talk, and we have to realize how much he is suffering, for how long he is suffering, and we have to take care of all these things, and we will decide which patient we have to go for surgery.
And is surgery safe for young children?
Yes, very good, and it is one of the concern. See, as I told, surgery is not the first option. Okay, we have, for mild to moderate cases, we have fantastic medicines like nasal sprays are available. In case of infections, we have to treat with the supportive measures. If it is bacteria, we have to give antibiotic. In some cases, very rare cases only, we have to go for surgery. In that case also, see, these adenoids and tonsils are, as I told, it is responsible for our immune system. So if it is chronically infected because of the recurrent infection or inflamed, what happens? It is destroyed. See, it's recurrently infected follicles, so it is not functioning properly. So that's why we are removing it. But there is an age limit, like we will keep it after 3 years. So usually what we are doing is, if the child needs surgery, we will postpone the surgery till the age of 3rd for adenoid.
Okay.
Yeah.
There is a belief that removing tonsils will weaken the immune system. Is it true, and what's your suggestion?
Yeah, as I told, it is not true. Like our immune system, especially for kids and children, it will adapt very easily. So after after some time, like adolescence and all, we have some more immune system, like bone marrow, the immune system especially coming from the bone marrow. So if it is damaged, like chronically inflamed, it gives more harm than the good thing. So we have to remove in that case, and it will not affect our immune system. In our majority of the studies, what it says, it will never affect the immune system if we remove the adenoid and tonsil after 3 years.
Can we prevent tonsillitis and adenoid issues? Can you give us some tips?
Yes. So basically, many things we can avoid. So I will start from the allergies. So basically, it is an immune system, like it is like a guards, as I told. It will protect us from the pathogens. So basically, it is coming from the inhalation and the swallowing. So when the allergies or pathogens comes into our body, it will defend. So if it is keep on coming, what happens? It is inflamed. So basically, we have to avoid allergies. We have to avoid pollen and mold exposure, environmental pollutions, dusty area, smoky climate, and avoid like smoking. Like we have to avoid passive smoking in home, and recurrent contact with the sick people. If the child is having this adenoid or tonsil issue, we have to keep a double sure, like we have to avoid the contact with other people having the sickness, and take a air purifier. if the patient is having allergy, put an air purifier in the home and humidifier. It will humidify the air. These things, lifestyle changes we have to make, and make a good diet, like a balanced diet. It will make the immune system much more stronger, and as I told, avoid these allergens.
Doctor, is there an effective vaccine to prevent this recurrent infections?
Yes. Yeah, this vaccine is very important for preventing these adenoid and tonsil issues. So we have to take flu vaccines and streptococcal pneumonia, the pneumococcal vaccines. These are very effective for preventing these adenoid tonsil issues.
And Doctor, finally, what is your advice for our viewers regarding tonsillitis and adenoid issues?
Yes. So if the child is having persistent symptoms like recurrent sore throat and nasal issues like mouth breathing, snoring and sleep apnea, or the child is having recurrent ear infections and hearing loss, we have to take a timely intervention. So if the child is having persistent symptoms, we have to take an ENT opinion as soon as possible. So it will improve the quality of life, and it will remove so many complications, because if the prolonged mouth breathing, it will definitely change the shape of face, and there will be so much crowding, high arched palate, and it will affect the dental hygiene, as well as there will be ear blockage. So timely ENT consultation, it will change the quality of life. So I am available here in Al-Hilal Premier Hospital, Sagaya, every day except Friday from 8:30 to 4:30 for ENT consultation.
And Doctor, before we wind up, what do you have to say about Al-Hilal Premier Hospital? What are the services you offer in Al-Hilal Premier Hospital, especially in your department?
Yeah. And in our department, ENT department is fully fledged in Al-Hilal Premier Hospital with nasal endoscopy that includes rigid endoscope and flexible nasal endoscope. So the benefit of the flexible endoscope, it is very easy and easy to put in, especially for kids. And we have X-rays to diagnose adenoid issues. We have a very good audiology room, and it will assess the hearing, especially pure tone audiometry, tympanometry and all. And the OT team, like if the child is needed surgery, we have very fantastic operation theater, including all the high equipments. Initially and all the past years, we used to do conventional adenoid tonsillectomy. Nowadays we are doing with the coblation adenoid and coblation tonsillectomy, and we have some other instruments like a debrider, laser and all. So what is the benefit of this coblation means it is really painless surgery. Coblation adenoidectomy is painless and bloodless surgery. So the recovery is very easy. We are doing adenoid cases as a day care. So morning we will do the surgery, and most of the time evening we will discharge a patient, and after the post-op it is like a pain-free surgery usually by this coblation. So the post-operative pain and complications are very rare in coblation. So if you consider any like adenoidectomy and tonsillectomy, this coblation technique is much better than the conventional method.
Thank you, Doctor.
Okay.
Thank you very much.
Okay, thank you for watching.
So viewers, tonsillitis and adenoid issues may sound simple, but recurrent infections may affect the quality of life in children and also in adults. But with early diagnosis and appropriate treatment, the symptoms can be managed and the quality of life can be improved. I hope this episode is helpful. And for more informative episodes, tune into BMC Global Live Al-Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jasila Mujib signing off. Good night.